Kia ora koutou katoa, nau mai haere mai ki te manatu hauora. Thank you very much for joining us up here again today. Before we get underway on Omicron outbreak and other matters around COVID-19, I wanted to mark today as World Health Day, the anniversary of the founding of the World Health Organization in 1948. New Zealand has a strong reputation when it comes to public health and our contribution to global public health, and we have an excellent global health group here in the Ministry, and I want to acknowledge the work they do on an international level, and in particular they've played a critical role in supporting our vaccination support efforts for the Pacific over the last year or so, and have done a great job. So as we're all aware, the ongoing COVID-19 pandemic has certainly highlighted the delicate relationship between people and the planet. And the World Health Organization, along with our other international partners, has been pivotal in guiding our global public health response. As you can see, I'm joined here today by the Director of Public Health, Dr. Caroline McElnay. She's joining me for the last time today, which is I have mixed emotions about, and she is going to give you her view on the last couple of years of the pandemic response here in Aotearoa. Before I do hand over to Caroline, I'd like to just give a quick update on the current outbreak and then a little bit about some new research we have into New Zealanders' willingness now to comply with ongoing COVID-19 public health measures. First, an update though on the daily numbers. Today, there are 11,634 new cases in the community, and we're seeing our 7-day rolling average of cases continue to decline. Today, the 7-day rolling average is 11,791. That compares with a week ago when it was 14,515. Today, there are still 639 people in hospital around the motu, a small decline of yesterday, where there were 654. 29 of those people today are in intensive care or high dependency units. Sadly, today, we're reporting a further 13 deaths of people with COVID, taking the total number of publicly reported COVID-19 deaths to 456. And our 7-day rolling average is now at 17. My sincere condolences, as ever, to the whānau, the friends, communities that have been impacted by these deaths. Further information with all the detailers in our 1 o'clock update. I've now got just a few slides to go through to provide some visual demonstration of what's happening with the outbreak around the motu. Our weekly rate of cases fell over this last week to from the previous week, where it was 22.5 cases per 1,000 people. It is now down to 18.5 cases per 1,000 people. And if we look at the rates by region, you can see, and the legend may be slightly challenging to read there, but the important one, the one that goes up high, the green one, is the northern region, and we saw it went up to a much higher peak earlier on and has now dropped to about half the case rate in the other 3 regions around the country. The other thing I just want to point out is if you look at where the rates were at on the 30th of March and then compare those with the 6th of April, it's really only since the end of March that the rates have started to decline in the southern region. So when we did our last public health risk assessment, that informed our advice to keep the country in that red setting, the rates were still on the climb actually in the southern region, and they were pretty much levelled off in the Midland region, which we call Te Manawataki. So we're only really seeing that decline in all regions just in this last 1 or 2 week period. And of course, that will be part of the information that will go into the public health risk assessment that the team is doing again next Monday to inform the government's decision next week ahead of Easter on what will happen with the CPF colour, currently still in red around the motu. Second slide, again, just updating that, look at the hospitalisations across the northern region, which is Metro Auckland plus Northland. We're seeing they are declining, but quite slowly still. And there are still quite a number of people on the wards in the Auckland region. Hospitalised cases peaked at 842 on the 29th of March, and are down now to, as I said earlier, 639. So they're on the decline, but this is a long tail of hospitalisations. And of course, not all of those people are in hospital because of COVID. We estimate around 30 to 40% of people are there with COVID as an incidental diagnosis, or not the primary cause of their reason being in hospital. But that does still leave around 400 people or so who are in our hospitals around the country because of COVID, and obviously that means those beds and the staff caring for the people in those beds are not available to do other care. And the final slide I have is just showing again those hospitalisations in the Northern Region hospitals. And this is new hospitalisations each day, and we can see it is tracking down, so that many of those people who are in hospital have been there for some time and are staying because they need longer care. So it is tracking down in line with that high transmission scenario, but still, as you can see there, around 40 people being newly hospitalised each day with COVID in the Northern Region. And just on to some new research that was undertaken in mid-March, between the 11th and 18th of March, by the Department of Prime Minister and Cabinet's Unite Against COVID unit. It shows that 2 years into the pandemic, the large majority of New Zealanders are still willing to and are complying with COVID-19 public health measures. The research showed that 76% of us stay home if we're feeling sick or unwell, actually up 3% since January. The same proportion, 76% of people self-isolated if they have COVID-19 symptoms or are waiting for a test result. And 75%, so 3/4 of us, are using face masks in shops and on public transport. The only areas where people are less willing to comply is in two areas where they no longer need to. Still, though, a massive 74% of people are taking and using their vaccine pass where it's asked for, even in places where it is no longer necessarily required, while 63% of people are still using their NZ COVID Tracer app, perhaps out of habit. And because, as we've said in the past, it may well be we need to use the app again to help with our efforts, please do keep it on your phone. And if staying in the habit of scanning is something you still do, well, that's fine. So a huge thanks. I think these results are very encouraging, and thanks to everyone who's willing to continue to act in the interests of everybody to help minimise the impact of COVID-19 on our communities. I'll hand over now to Dr. McElnay.
Kia ora koutou katoa. Thank you, Dr. Bloomfield. 2 years ago, New Zealand was in the early stages of our COVID response and in alert level 4 lockdown. It was a pivotal time in our nation's history, and we've all learnt a lot since then. But a lot has also changed. COVID has changed our landscape and continues to do so. We scanned QR codes, used vaccine passes, and wore masks. While some of these measures aren't needed for now, wearing masks has become part of our daily lives and will continue to be so for some time yet. We know that wearing masks in indoor environments, including schools, helps to protect people from catching COVID. That's why they are part of the COVID protection framework at both red and orange settings, and they are a critical aspect of our public health response. But we also access healthcare differently. We often did this virtually during lockdown. We set up special centres for testing and for vaccinating. Healthcare services put many different protections in place in workplaces to protect their staff so that they could continue to provide care, and to protect patients so that they could continue to receive treatment. Car parks became much more than a place to park your car and became assessment sites and vaccination sites. We've all changed the way that we've worked. We have Zoomed and continue to Zoom. Like many others, I've learned to quickly find and use the mute key. Sometimes I can't actually find the mute key, to be honest. But my team and I frequently work from home, and many others do the same. COVID has also sped up science. Scientists effectively show progress through publishing scientific papers, which makes the information then available to the science and health communities. Pre-COVID, that process often took months. But during COVID, it was clear that sharing information was key. Information that could help understand the science behind the pandemic and assist in tackling it needed to be fast so it could be used equally quickly. We've seen more online papers being produced and published, and it's allowed the fast spread of important information to the science community and the public, often within days. The end result has been the rapid advancement of science, of vaccines, of treatments, of knowledge, of experience and understanding. Applying that knowledge, which has improved as time has gone on, has held New Zealand in good stead. Vaccines and treatments effective at keeping people out of hospital were developed fast, and advances in tracking and testing were equally quick. New Zealand has been very fortunate that we have been able to bring the public with us through lockdowns, hand washing, physical distancing, testing, vaccinations, isolation, quarantining, and staying home when sick. There have been frequent changes in advice and approach as we have learned more about COVID, and we've learned more about how best to manage and prevent spread. We have endeavoured to use the science, evidence and experience both from here and overseas to guide our advice. I am very aware of the impact that our advice and guidance, underpinned by regulations, has had on many, many people's lives. We have been fortunate to have a solid foundation of trust by the public in our institutions, our health sector, and in our approach for the past 2 years. People have listened and people have acted. We are aware that our messages are ones that often compete with other messages. There have been what at times has felt like an overwhelming level of information produced about the pandemic. There has also been a rising level of misinformation, often called the virus within, and this has spread globally as well as locally. We've increased the level of information that we've provided to the sector and to the public to help ensure there is readily available sources of information that people can trust. Our daily 1 p.m. statements continue, and our 1 p.m. stand-ups, of which I have been a part, including the very first stand-up we streamed on the 27th of January 2020, when there were 2,000 cases globally and none in New Zealand. And at that time, travellers into New Zealand were being asked if they had got sick within a month of arriving to provide their travel history to their treating health professional. These stand-ups, and this, I'm reliably told, is our 299th stand-up in 2 years, will continue, though they'll do so now without me. I'm sadly leaving the ministry, though it remains in good hands and in good heart. I'm travelling overseas, and it will be some months before I come back to New Zealand. It's been an honour and a privilege to have served as Director of Public Health during this time, and there are many, many people to thank for the support that they've given me during this time. I particularly want to acknowledge my outstanding team of public health doctors here at the Ministry of Health, who have worked with me to provide the very best public health advice throughout the past 2 years. But I want to finish by thanking you all New Zealanders, for getting us to where we are today on what has been a roller coaster of a ride. And I'd also like to thank you in this room, the media, for your extensive coverage throughout the pandemic, helping to keep the public informed about the necessary public health measures to keep ourselves and those around us safe. Ngā mihi nui. Back to you, Dr. Bloomfield.
Kia ora, Caroline, and I think that very first stand-up we did was in a much smaller room with reporters all crowded in, none of us wearing masks, just next door to here. We've learnt a lot in the last 2 years. Some of you, I think, were there. Now, there's been some speculation and perhaps concern in the last 12 or 24 hours about the timing of Dr. McElnay's and my departure. Dr. McElnay, as she said, finishes today, having decided several months ago, for a range of very good reasons, that now is a good time to do so. I am here for another 4 months, till the end of July. Dr. Jim Miller, who's a Medical Officer of Health at Toitiora, which is the public health unit that covers the Bay of Plenty and Lakes District Health Boards, has already joined us to act in the Director of Public Health role while Dr. McElnay's replacement is appointed, and that process is well underway. Jim joins a team, as Caroline has mentioned, of very able public health physicians, and we have a range of public health physicians across the organisation. Being one myself, I'm always of the view you can never have enough public health physicians. So we have very capable public health leadership in this organisation and indeed across New Zealand. People who are and will continue to advise on and help lead our ongoing response to the pandemic. But just before we do cut to questions, I want to take the opportunity to say a personal thank you to Dr. McElnay, as this is her last media stand-up. Now, I acknowledge the COVID-19 response has involved many people across many organisations in the public sector, the private sector and the health sector. And it has been the work of many rather than one individual, and that has meant we have all achieved what we have to date. Having said that, Dr. McElnay has been instrumental and often the public face of the Ministry's response to the pandemic, so I'd like to recognise and celebrate that. Dr. McElnay started at the Ministry in 2017. She came from Hawke's Bay District Health Board, where she had been their Director of Public Health. And in the last 5 years, her contribution to the health and disability system has been absolutely critical, particularly in the last 2 years, where it's included overseeing the public health response to that initial outbreak here in this country, our Delta and Omicron outbreaks more recently, and also that crucial public health advice to inform, it seems like a long time ago now, but the alert level framework, more recently the COVID protection framework, and now our Omicron response plan. She's developed a great team of people here in the Ministry, critical relationships and a great deal of respect across the health sector. And she has supported the Ministry to deliver, often in very challenging circumstances, our COVID response over the last 2 years. A mammoth effort indeed. Personally, I just want to fully acknowledge Dr. McElnay's calm and supportive and solution-focused approach throughout the last 5 years, but in particular this last couple of years. She's been a real rock for me, and it's always a pleasure to be able to do these sessions together. It's a challenging role, being Director of Public Health, Caroline. You've embraced it with grace and energy. You've become a recognisable face to the public, and I know there was much speculation about the length of your fringe during the first lockdown, and it was sort of the marker for how long we might have been in lockdown was the length of your fringe, and I know you greatly enjoyed that first visit to the hairdresser to stop all the speculation there. I'm pleased you're having a break, and I know you will return to continue contributing to public health in New Zealand. So kia kaha aroha nui. Hei ona anō kanui tēnā kia ora koutou katoa, and Caroline's now happy to take questions.
Dr. McElnay, can you
Please.
tell us why you have decided to resign?
When I took this job 5 years ago, I made the decision to continue to live in Napier and to travel down to Wellington. And at the time that I took on that job, I said that I would, 5 years was a good length of time to consider doing that. It has been tough doing that constant travelling. It's also been tough during lockdowns when I've been here in Wellington and not able to travel home. So for me and my family, it was just the right time to step away and spend some time.
So
the Director General yesterday mentioned some of the misogynistic abuse that senior public health figures have been facing in New Zealand. What sort of vitriol did you receive, and how did you cope with it?
Well, I haven't received too much. As Dr. Bloomfield says, I did get quite a few comments about my hair, which I'm not sure if he got quite the same criticism about his hair. Look, I don't really engage much in social media, and I find that the less you read the comments, the better. I'm here to do my job, and I do that in the best way that I can. And if I get the positive feedback that I want is from my bosses and the other people that I'm working for. So it doesn't. I just don't really engage in it. But I have received some.
Is it hard
Where do
to
you plan on travelling to? For how long? And do you plan on returning back to the Ministry of Health when you return home?
Well, I'm certainly planning to return to New Zealand. We're going for an extended trip overseas. We're still doing some of the detailed planning from that. As many of you know, I'm originally from Ireland, so I'm going to certainly catch up with family and friends over in Ireland and in Europe. And I've got no job planned to come back to, but I'll just look and see what opportunities there might be for me when I return.
Is it hard to leave the role now when the pandemic isn't over yet?
It is hard. It is. I don't think there's ever a perfect time to leave any role, but it's certainly been on my mind about when is the right time to leave, when this pandemic certainly is set to continue for some time. But I felt very much, and that was the conversation that I had with Ashley, was from a public health perspective, I think we've achieved a lot in terms of the approach to COVID, and we are moving on. We're looking at how we can continue to protect the most vulnerable in our community and make sure that they don't suffer from the worst outcomes from COVID. And so from a public health perspective, I think that is about public health standing back and our health services, our treatment services, picking up that load. So for me, that was then a good time for me to say, I can hand that mantle over to others.
Dr. McElnay, burnout has been discussed as a possible factor in your resignations, and most New Zealanders will probably not begrudge that. But what advice do you have for other Kiwis who, after these 2 very stressful years, might be feeling burnt out, but have to keep working, for example, because they just don't have the financial resources to take time off?
Well, I think, firstly, burnout is a very real thing, and we do need to acknowledge that, and workplaces need to acknowledge that, but also people themselves need to acknowledge that. I personally do not feel burnt out, but I do feel tired, and there are things that I'd like to be able to do, and things that I'd like not to have to do. So I do think that people, if you are feeling tired, then that's a real feeling. So, talk to your family and friends and talk to your health professionals. It may be that you feel that you can't take some time out, but I think employers in particular are very aware about burnout for a number of reasons, as well as the impact that we've all seen that COVID has had. So I would encourage people to sort of listen to themselves and talk to people.
I mean, in some parts of the world, they're talking about a post-pandemic mental health crisis due to lockdowns and other stresses. Are we facing a post-pandemic mental health crisis in New Zealand?
Well, I think, and Dr. Bloomfield might want to speak to this, I think we're very aware of that possibility and the need to plan to make sure that we have got services in place to deal with that. We are aware that people have been very stressed for a number of reasons because of the COVID response. We've seen that overseas, as you say. So we do have to make sure that we are as prepared as we can be to support people as we continue in our journey through COVID.
Do you think the government and the public sector is doing enough in that area?
Dr. Bloomfield might want to speak on that, but I'm certainly aware that the planning has started to look at what is needed, and I think that's always the first critical part. Dr. Bloomfield's very aware of my love of plans, that we need to have a plan before we launch and do something, and I think that's always going to be the first step, and then implement.
What are some of those things you're looking forward to being able to do that you maybe haven't had the time for while you've been in this role?
Well, what I want to do is spend a bit more time hiking, in particular, doing some long walks, being able to go for a very long time without your cell phone. I'm actually really looking forward to that, and one of the advantages of going overseas is it makes it even harder for people to get hold of you.
Consider taking a role with the Health New Zealand when you return to the country?
Oh, I honestly haven't thought about what sort of role I might look at when I come back. I am a public health doctor. That is my passion. That's my background, my training. I fully expect to be working in public health in some capacity when I come back, and there will be new entities in place by the time I come back. So I'll be looking for any and every opportunity that I can. What I might be less keen to do is perhaps have a job that requires lots of travelling.
Dr. McElnay, yesterday we asked Dr. Bloomfield around his highlights in the past 2 years. What about for you? What has been your highlight, and are there any regrets that you've had?
Oh, there's been a lot of highlights. I wouldn't describe them as regrets, but there's certainly been some challenging times, or not even challenging, but certainly very awe-inspiring times. And for me, the highlight was probably right at the very beginning of our COVID response, when this building was full back then with the social distancing that we required back then, but it was full of people from across the government sector as we all came together to build a plan for our COVID response, and just to see the very many different people from different backgrounds and different government agencies all coming together to work together on a single problem, I think is something that I hadn't experienced. It was good to see, and I hope we see that for future events as well. So that was a highlight. What I will always take away with me was the feeling that I had myself watching the Prime Minister make her first announcement to the nation about the COVID alert level framework, and when she announced that the country was going into, I think it was alert level 2 in the first instance, and then we very quickly, later on that week, move into alert level 4. And I had been part of the discussions and the planning sessions, and along with Dr. Bloomfield providing that advice to Prime Minister and ministers. So having been in those meetings and providing that advice, and then suddenly the next day, not suddenly, but the next day watching it on television, made me feel how much what we'd done, and the awe-inspiring nature of that, and the responsibility, the weight of responsibility that comes with this job, and how you are affecting the lives of so many people. You know, that weight of responsibility is very real, and has continued throughout. But I think that was probably one of the first moments when it just dawned on me exactly what was happening.
Looking back at the overall pandemic, how could the death toll have been less? Was there anything that you think could have or should have been done differently?
Oh, I think the death toll in New Zealand is staggeringly low. I just came off a call this morning with colleagues in the UK, the US, Canada, Australia, and our death rates in New Zealand are an indication of the success of the response that we had in those first couple of years. So I think certainly, whilst every death is a tragedy, and sadly for me in those early days, it felt like every time I did stand up, I was announcing deaths. And I know that social media for a while trolled me as Dr. Death. But it's, I do think we've had such an amazing response here in New Zealand. I would really challenge anyone who says that our death rates are high.
Britain's response has been pretty disastrous. Why is that? Is that because they were arrogant? Did they, one, they looked to New Zealand as an example to emulate, for example. Were they conscious of how we were responding to it? I mean, you have a lot of contacts and friends in Britain. Were they conscious of the way we did it?
I think every country has responded differently according to the context of that country. And I did my public health training in England, so I know that public health in England is the same as public health here in New Zealand. We all use the same evidence and analyse it in the same way. New Zealand does have some points of difference to the UK, which did have an impact on our outbreaks. You know, we were in those early days able to look and see what was happening in the rest of the country. They were much further advanced in terms of cases than we were. And we also, as an island nation, were able to close our borders. And it really was the closing of the borders as that real first step that protected us and gave us time to have a vaccine, to get people vaccinated, and now allows us to open up in the way that we're doing.
Just for either of you, just looking ahead at how the pandemic might play out, we wondered, I mean, how well prepared are our frontline staff, such as GPs, for an influx of long COVID cases?
You want to try that one?
You're doing a great job here, Carol. Maybe I'll give you a question, have a sip of water.
Thank you.
Yes, a quick comment on that. So just as the overall pandemic response, and Caroline articulates this really nicely, has moved from a real focus on broad public health measures, so a largely public health-led response, to a much more health sector, healthcare type response. We're also needing to shift from just responding to the acute COVID illness through the healthcare system and looking after people, to supporting people who have longer duration symptoms. And of course, this is not something that's unique to COVID. There are people who have post-viral symptoms and that sometimes last for years. So we need to gear our healthcare system to have the resources and the funding to be able to look after people who have got those symptoms that go on for quite some time. And that's part of our planning ahead as part of our winter planning as well, thinking about not just how we keep responding to people with COVID and other influenza-like illnesses, but that they're able to provide the support that is needed for those with ongoing symptoms. Sorry, I'll just go over here.
Well, actually, a follow-up for Dr. McElnay.
Are there any more questions for me? I'm happy to hand it over.
On the traffic light settings, when you give advice to Cabinet next week, you pointed out the declining number of cases in the regions, including the southern region, and the slow decline of hospitalisations. Do you think next week will you be recommending that we move to orange?
I couldn't say. What happens is that there's a process that's undertaken by the public health team in particular, but a whole lot of people play into that, and that will happen on Monday. I get the advice and then it flows through to advice to government, so I don't want to second guess that.
Do you think it'll be safe by that? You know, are we moving towards a period where it is safe to move to orange?
As I've done for the last 2 years, I'll wait to get the best possible advice I can get from my team.
Can I ask about the strain on the healthcare system though? I mean, is that trending downwards as well alongside these graphs here, or does the healthcare system remain considerably strained due to the impact of COVID on its staff?
So there is ongoing pressure on the system, but and the slides I've shown are just around hospitalisations. Of course, most people who need care are looked after by general practice or in the community, but the pressure is easing there in terms of COVID-related illnesses there. All that does allow, both in general practice and of course in the hospitals, is for them to gear up other care. So in general practice, that means care that might have been deferred, like preventive care or management of people with chronic conditions. They can start to do more of that again, and likewise in the hospital, more planned care. And so the DHBs through this outbreak have been very good at just making sure it's not an on or off with planned care. If they can do any planned care, they've been doing that right through the outbreak.
Right. The Prime Minister referenced the strain on the healthcare system due to the virus's direct impact on its staff as being a key concern. You know, is there going to be a markable difference between this coming Thursday, and today? Do you think? Is it improving that quickly? Is what I'm asking.
Yes, it is improving, and you've pointed to the thing that is probably a major factor, and that is not so much that there are less people in hospital, but there are less staff off with the illness themselves, or because they are close contacts, or because they're looking after family members. And as those case numbers continue to decline, that will mean that there'll be less staff off, and that will mean there's less pressure, and certainly in the hospital side of things, but also in primary care. So that will be one of the factors that I think will be material in terms of the difference between perhaps early next week and 2 weeks ago when the last assessment was taken.
At the end of the month, the school holidays at the end of the month, how will the school holidays affect case numbers?
Really hard to know. I think the key thing will be whether school's in or out. It's those basic health measures, public health measures, that are going to be important. Arguably, and Caroline might correct me here, but I think what we've seen in the past is that school holidays have actually not resulted in, often we've been concerned they'd result in quite an increase in infections. In fact, often we've seen the opposite. So, and it's still, hopefully the weather's still going to be warm enough for people to be doing a lot outdoors as well, still as we're in April.
What kind of evidence are you seeing around a fourth dose of the Pfizer vaccine? And are you putting together any advice or planning for a second booster?
Yes, and that advice is going to ministers this week, so you could expect an announcement on the decision around that fairly soon. But certainly we've been looking and seeing what other countries have been doing, and the groups that are most likely to benefit or need a fourth dose are those who are the most vulnerable, and that's the advice that, well, I've got the advice now, it's going through to ministers for a decision.
It would likely go to the immunocompromised and the elder.
Well, the groups that other countries are offering a fourth dose to are largely older people and immunocompromised people of all ages. That was the question.
What do you think the scale of the loss of planned care is in this outbreak?
Well, I don't have them with me, but there are some numbers. What I would say is it's probably been less than in other outbreaks, because through this outbreak, all our district health boards have maintained as much planned care as possible, whereas the response framework in earlier outbreaks, where we were still in that very strong elimination type approach, most planned care, virtually all planned care, was stopped to help avoid the risk of having cases inside hospitals. So all the DHBs have had plans right through to maintain as much planned care, both outpatient and inpatient planned care, as they could through the outbreak.
And how would you like to see DHBs kind of make up for lost time? How do you think they should do that?
Yeah, they're already been working on that for some time. I mean, they had plans in place, and the key thing here is they will be prioritising people whose care is the highest priority, and of course that means people who require either diagnostic interventions like radiology or treatment for things like cancers or things that are time critical. But they will be working on plans to make sure everybody whose care has been deferred is delivered in time.
Just looking ahead to winter, yesterday you mentioned that you wanted childhood vaccinations up. We've obviously got borders easing as well, and the likes of, flu, measles, for example, coming through the border. Are you concerned about a perfect storm, basically, coming this winter?
Concerned enough to, as are my colleagues across the system, to have put in place some plans to avoid the perfect storm. You'll know the vaccination program for flu started on the 1st of April. Really good early interest and uptake. The pharmacists are saying that they've never seen quite so much demand. So already by midnight last night, 56,000 doses of the flu vaccine had been given across the Motu. Actually more, because we only get the general practice numbers once a week. We haven't got those through yet. There's a program underway to really ramp up the MMR catch-up campaign again, and that's going live as well. So yes, these are of concern, and so we're actively delivering the programs to try and avoid getting into that situation.
How popular has the Novavax vaccine been thus far?
Yeah, not very popular at all. I think under 2,000 doses have been given so far. Now I'm going to just hand back to Justin, had a question for Dr. McElnay, so I'll trade places again.
Thank you.
Dr. McElnay, just going forward, I was just wondering, how satisfied are you with the current set of COVID rules for the country, and is there anything you would change?
The current framework has been well worked out. My team and I were part of that, so it is based on public health logic. I think the framework, the key to the framework is moving through the settings and through the different colours. And we have had experience going up, but we haven't yet had the experience of coming down. And we saw that with alert levels, that it is always different coming down to going up. So I am satisfied that the framework provides that level of protection for the community. And the framework is the essential thing about the framework, though, is that it relies on a highly vaccinated population. And regardless of the framework, there are some public health interventions that are the interventions that stay in place no matter what. So they become the sort of fixed level of controls, and vaccination is the number one for those. And that's where the boosters come in as well. That is really good evidence that you have that third booster, you get really good protection. And then alongside that is how we manage cases and contacts and the isolation periods for those, because the theory there is around reducing transmission. Your cases are the people that you know have got infection, so you know that they're the ones who are most likely to transmit it. So how we manage cases and contacts. And then the rest is to ease you down through that, the layers of protection, and that's then where, with the orange settings, the requirements for masks, and then ultimately into green when it will be a recommendation for masks, but less of a requirement.
And you mentioned that in your opening statement just about masks. I mean, how difficult will that be? Because as far as we can see kind of into the future, there will be Omicron cases in the community. If we're moving to green and that masking requirement is lifted, is it possible, do you see with widespread community transmission that we could have a situation where the government says it's okay to ditch masks?
I think there's a difference between requirement and recommendation, and from everything that we've learned about COVID, the masks are very effective. What we've seen overseas, and actually on the call this morning, a comment was made about how other countries, as they're that little bit further ahead in their COVID journey than us, what they're doing is they are allowing more regional decision making around what's the rate of illness in your community, how's that affecting your population, and at that point then increasing the messaging around this is the time to start wearing masks. May not be a requirement, but it's actually a recommendation. So, this is the time in this community you might want to think about wearing a mask when you go out to various settings. And that may well be where we end up, where we've got an understanding and appreciation of the benefits that a mask brings. There might not be a requirement to wear a mask, but actually that understanding and I think that is the way forward, is that actually we as a community understand what we need to do and make those choices ourselves. So have your I remember saying at a meeting earlier on, we'll reach a stage where we all have a mask in our pocket, and then we use that mask when we need to.
And what's the advice you're leaving for your successor?
Ooh. Well, Dr. Jim Miller is starting as the acting.
Permanent successor.
The permanent successor well, it's going to be interesting for the permanent successor because the health system is going through some changes. So the permanent successor will be working as part of a public health agency, and the public health agency will be sitting within the ministry, which the ministry itself will be a bit different, and there's also Health New Zealand. So my advice to my successor would be you need to work out the structure, first of all, who's who. Relationships are actually really important in this job. The ability to get on with people and find out who's responsible for what and who who the decision makers are and how you can best do your job. The job of a Director of Public Health is to promote, protect and improve the health of New Zealanders, and there are many others who are doing that job as well. It's just that you've got a particular title which allows you to open doors to have those conversations. So I would advise them to work out which doors to open and open those doors.
A question on daily case numbers. I'm not sure who would like to answer this, but with the Southern DHB, with their cases now declining, does that mean that the Omicron outbreak has peaked nationwide? And what does this mean for daily case numbers moving forward, and kind of where do you see us settling in terms of daily case numbers in the low thousands, or where would that end up?
I think we've probably mentioned this before, that we do expect to see this long tail, sort of a bumpy tail, and looking at what other countries have seen, that could be in the 2,000, 3,000, 4,000 cases a day mark. It'll be different in different parts of the country. we're already seeing that with quite a different drop-off, a steep drop-off in the Auckland metro areas, but in more rural areas, it's more of a sort of a gradual decline, and we anticipate that we'll have a long grumbling tail of COVID, that we might see some spikes along the way. If we look at our nearest and dearest neighbours in Australia, they're seeing it sort of going back up, but actually it'll probably come back down again, and that's probably our prediction.
So the outbreak has peaked?
I think we've got increased confidence just from the case numbers that the numbers have peaked, but bear in mind that we are aware that we're basing our case numbers on the self-reported results from the rat tests. So I always look at it from a pattern rather than from the actual number, but certainly when you look at the pattern, it looks like we've got a bit more confidence to be able to say that we're over the peak and we're coming down from case numbers.
Dr. McElnay, last week you mentioned there was a task force within the Ministry of Health looking at what to do about dropping childhood immunisation rates. Have you received any advice from that task force? And if not, when can we receive that sort of advice, and what sort of advice are you expecting from that?
Dr. Bloomfield might want to comment on this. I haven't received that advice. The task force itself, I'm not aware has actually been set up. Last week I talked about us needing a task force because we do need to look. Childhood immunisation is something that requires a lot of different perspectives and guidance from the sector and from communities as to how we get those rates back up. So it's still very much a priority for the ministry. Don't think the task force as such has actually been pulled together yet.
Right, well, thank you very much for coming up again. And Caroline, I think you've demonstrated today why you are such a treasure for this country. Thank you again for your amazing contribution. And I know many, many people around the motu will be sad to see you going, but wishing you all the very best. Kia ora. Thanks again.